Today I am going to talk about disorder of salivary gland, particularly parotid and submandibular. As you all know that salivary gland, they are usually major and minor salivary gland. Major salivary glands are paired like parotid, submandibular and sublingual. Minor salivary glands are distributed throughout the buccal mucosa, soft palate, hard palate and maybe aerodigestive tract. But majority of the problem they occurs in the parotid region and submandibular salivary gland. And sublingual gland may be ranula. Most commonly asked, there is a swelling in the floor of the mouth, and that is how. So we will be going to talk about parotid swelling. By and large, there is a swelling in the parotid region. Most of the time, patient just come with the history of swelling in the parotid region, maybe for 1 year or 2 years, and usually there is no other problem by and large. So that is the commonest clinical presentation of these patients. So whenever any patient come with the swelling in the parotid region, our aim is to know about whether it is inflammatory or neoplastic. By and large, inflammatory swelling, all of you know, in the parotid region, they are usually in the younger age group, it is due to mumps, and very rarely it can be a parotitis, which usually occurs in the old age group, post-operative dehydrated patient. But these swellings are painful. So any swelling in the salivary gland, whether parotid or submandibular, if it is associated with meal, there is a swelling when patient chew something, and after 1 or 2 hours the swelling disappears and pain is also lessened. And fever sometimes is there, malaise particularly due to mumps, usually maybe bilateral or unilateral. But as present we are more concerned about these swelling which are neoplastic in nature. Like parotid swelling, patient present just with a swelling and usually there are no other complaints. Our aim is to differentiate whether it is a benign swelling or it is malignant tumor. Benign tumor is most common in salivary gland. In the parotid, 80% of them they are benign, maybe 10 to 15% are malignant. And the commonest, all you know, is pleomorphic adenoma. So on clinical examination, our main purpose is to identify whether it is benign or malignant, and local examination as for any other swelling. And if most important part in this is to examine the facial nerve. Benign swelling does not cause involvement of the facial nerve. If the facial nerve is involved, it is 99% is malignant swelling. The facial nerve is intact, usually benign, but there is a chance of malignancy also. So you have to ask the certain question from the patient again, that since how the swelling is started, since when it is there, what has happened in the duration when the patient first noticed the swelling, and why he has come to the hospital now. Patient may say that it was there, small in size, now it is progressively increasing, and that is why he has come to the hospital, and usually they do not have any problem. Of course, sometime they may come with facial nerve involvement. In this, there is a angle of the mouth deviation, difficulty in taking the bolus of the food inside the oral cavity, and there may be difficulty in closing the eye. Obviously, there are very sure short sign of involvement of the facial nerve, and now that tumor which was there earlier has changed into malignancy. So then you have to ask certain question from the patient. I'll be demonstrating. क्या नाम है बेटे तुम्हारा?
अंकित.
ये तुम्हें यहाँ कब से सूजन है?
1 week.
सिर्फ 1 week से? अचानक हुई? दर्द होता है इसमें क्या? दर्द होता है? बुखार तो नहीं आया? नहीं आया. खाना खाने में कोई तकलीफ? खाना खाने से सूजन बढ़ जाती है आपकी क्या? फिर कम हो जाती हो, थोड़ी 1-2 घंटे बाद धीरे से कम हो जाती हो. अच्छा, इसके अलावा और कोई तकलीफ? कोई परेशानी नहीं है? स्कूल जाते रहते हो? घर में और किसी को कोई परेशानी इस तरह की? तो इसके लिए इसके पहले भी कभी हुई थी आपको? इसके पहले कोई इसका इलाज कराया हो आपने?
नहीं.
कोई तकलीफ नहीं हुई, ये पहली बार ऐसा हुआ है? अच्छा, घर पे कोई दवाई ली इसके लिए आपने?
नहीं.
किसी डॉक्टर को दिखाया कि अस्पताल में ही आए हो पहली बार? अभी आए हो पहली बार. Like this patient, he is a young boy. He is saying that the swelling has increased for last 7 days only. He is having some swelling during chewing, and it usually disappear after some time. So this is likely to be a inflammatory swelling, and in this age, it is particularly due to mumps. I have already said that it may be bilateral or unilateral. All right. For this, no particular treatment is required. By and large, treatment may be discussing later on. But this patient on examination, swelling of the parotid typically occurs in the parotid region with the recess of the by the mastoid and ramus of the mandible. This obliterates, and there is a lifting of the ear lobule. So whenever you want to appreciate the lifting of the ear lobule, you have to see from the behind. So any swelling in the parotid region with the ear lobule is lifted until proved otherwise, it is a parotid swelling. So our purpose of examination, again same in surgery, you have to remember one thing: if you know the examination of swelling in a proper way, most of the problem is sorted out, because it is examination of swelling. Again I will say site, size, shape, skin overlying the swelling, what is happening to the surrounding area, is there any lymphadenopathy, and in the parotid you have to examine the oral cavity for the opening of the Stenson duct, which is at the second upper molar tooth. Alright, then of course on palpation, again same thing, temperature is raised, tenderness which will happen in a inflammatory swelling, it is mobile, skin is involved or not, and intraoral examination you have to see for deep lobe involvement, because if there is a deep lobe is involved, there is a swelling on the soft palate also, and there is a deviation of the tonsillar pillar. So if the significant involvement of the deep lobe, never forget to examine the oral cavity whenever there is a parotid swelling. And then of course again neck examination, lymph node remains the same for any pathology in the head and neck when you are going to examine the lymph node in the neck. So usually parotid swelling, you will examine that the ear lobule is lifted, again examine it, temperature, tenderness, surface, mobility, is there any extension, borders are regular or not, is there any lymphadenopathy, right? And of course oral examination for any deviation of the tonsillar pillar, or sometime this involves the parapharyngeal space. So that is why there may be swelling sometime on the soft palate also. So by and large, in the parotid region, if there is a swelling, I think there is hardly any doubt that it is arising from the parotid gland. Sometime there is a intraparotid lymph nodes which can also be involved, which will be typical of parotid swelling. And of course other swelling like something arising from the mandible, you can make it, because that will be bony, hard in nature. Sometimes there may be a bilateral involvement of the parotid, which usually occurs in, I have already said, in parotitis or in mumps. Bilateral involvement of the parotid gland by the tumor is very, very unusual. So once you examine the swelling in the parotid, like let us say it is 3 to 4 centimeter in size, skin is normal, surface is smooth, it is non-tender, there is no extension of the swelling, there is no lymphadenopathy, it is relatively mobile, because parotid is not so much mobile because of it is encased in the enveloped by the deep cervical fascia. Another thing, clinical examination more often than not, student say curtain sign is nothing but this is a zygoma, parotid swelling sometime it is just only anteriorly here, anterior to the tragus. So it cannot go above the zygomatic arch, because this fascia attached to the zygoma. So that is why any swelling rising from the parotid will not extend superior to the zygomatic arch. So that is described as a curtain sign, so that you are sure sometime lipoma in the subcutaneous region may go above, but not parotid swelling. Reason I have already told you. So that is curtain sign. And of course oral cavity, I have already said that you have to examine it inside for deep lobe involvement, and the duct if it can be visualized, because sometimes it is very difficult to visualize the opening of the duct. But if there is any discharge from that, pus discharge or something, that you are sure that you are dealing with the inflammatory or infected swelling of the parotid gland. Alright, so once you have seen this, examine non-tender, likely to be a parotid tumor, but there is a diffuse enlargement of the parotid, bilateral, patient is having fever, malaise, they are likely to be due to mumps, and patient in the post-operative period, dehydrated, old, immunocompromised, maybe diabetes, or particularly HIV. These patients may have parotitis, which is sometimes turned out to be a serious condition and may land up into a parotid abscess. Patient becomes more toxic, high grade fever, and there will be tenderness, swelling, maybe sort of skin may be involved in that, and it is fluctuation usually does not occur. I have already said, because it is enclosed in the layer of the cervical fascia, that is why. But on clinically, there is no confusion that you are dealing with benign swelling or it is infective swelling. You can very well make sure that what is the condition like this. There are very other rare conditions. Sometimes parotid hypertrophy occurs bilaterally. Again, patient who is chronic alcoholic, these type of patient, they develop bilateral parotid hypertrophy. There may not be any other feature except there is a bilateral parotid enlargement. And sometimes other glands may also be involved. There are some syndromes, Sjogren syndrome, or all the glands may be enlarged and patient may be presented with xerostomia. So once I think, as far as parotid swelling is concerned, there is not much problem. It is typically located in the parotid region, and patient usually complain just swelling that may present for 1 year, 2 year. When they come to the hospital, it is just because of the size of the swelling. Rarely, of course, sometimes high grade tumor of the parotid, there is a very fast growth, maybe involvement of the skin, involvement of the facial nerve. That is means we are dealing with the malignancy of the parotid gland rather than a benign pathology. And on clinical examination, you are very sure that you are, if no facial nerve involvement, no skin involvement, likely to be a benign swelling. However, diagnosis will be confirmed by further investigation, which I will be talking little later.